Hello everyone, this is Chuti Chen. Today we are going to talk about administering oxygen by cannula and face mask. Here are the objectives. First one, to describe and differentiate oxygen delivery systems. Second, to demonstrate steps used in administering oxygen by cannula or face mask. Supplemental oxygen is provided to patients who have hypoxemia due to various reasons, including the reduced ability for diffusion of oxygen through the respiratory membrane, hypoventilation, substantial loss of lung tissue, cardiac dysfunction, brain injury, inadequate numbers of red blood cells or hemoglobin to carry the oxygen. The purpose of nasal cannula and face masks are to deliver oxygen as needed for patients, to maintain a pattern airway and prevent airway obstructions, to promote respiratory function, optimal exchange of oxygen and carbon dioxide into and out of the lungs, respectively, to prevent pneumonia resulting from accumulated secretions. Prompt treatment of these conditions with non-invasive oxygen administrations can prevent the need for more invasive procedures, such as intubation and mechanical ventilation. Portable systems, cylinders or tanks, and those from wall outlets are the ways the oxygen can be supplied in healthcare facilities. Oxygen from a cylinder or wall outlet system is dry. Dry gases dehydrate the respiratory mucous membranes. Therefore, humidifying devices that add water vapor to inspired air are essential. On an oxygen cylinder, the volume gauge indicates the pressure or amount of oxygen remaining in the tank, and the flow meter or flow meter indicator indicates the gas flow in liters per minute. A nasal cannula is a narrow, flexible plastic tubing used to deliver oxygen through the patient's nostrils. A simple oxygen face mask is a plastic device that is controlled to fit over a patient's nose and mouth. It has open side ports that allow room air to enter the mask and dilute the oxygen, as well as allowing exhaled carbon dioxide to leave the contained space. A partial rebreathing oxygen mask is similar to a simple face mask, except that the side ports are covered with one-way discs to prevent room air from entering the mask. A soft plastic reservoir bag connects to the mask that conserves the first third of the patient's exhaled air while the rest escapes through the side ports. Thus, it can make use of the carbon dioxide as a respiratory stimulant. A non-rebreathing oxygen mask has multiple one-way valves in the side ports which prevent room air from entering the mask but allow exhaled air to leave the mask. It has a reservoir bag with a one-way valve that prevents exhaled air from entering this reservoir. This allows larger concentrations of oxygen to collect in the reservoir bag for the patient to inhale. A venturi oxygen mask has wide-bomb tubing and color-coded jet adapters that correspond to a precise oxygen concentrations and flow rate. A nasal cannula delivers low concentrations of oxygen, 24% to 45%, at a flow rate of 1 to 6 liters per minute. A simple mask delivers moderate to high concentrations of oxygen from 40 to 50% at a flow rate of 5 to 8 liters per minute. A partial rebreathing mask is used to deliver high concentrations of oxygen from 40% to 60% oxygen at a flow rate of 6 to 10 per minute. A non-rebreathing mask is used to deliver the highest flow rate of oxygen from 90% to 100% at a flow rate of 10 to 15 liters per minute. The venturi mask delivers oxygen concentrations varying from 24% to 40 or 50 at flows of 4 to 10 liters per minute. When oxygen therapy is prescribed by the physicians, the nurse should double-check the order, then conduct a comprehensive assessment of the patient, including color of skin and mucous membrane, breathing pattern, chest movement, lung sounds, signs of hypoxemia or hypercapnia, and lab findings, etc. The nurse should place the patient in a comfortable position, preferably semi-flawless or full flawless position, to assist breathing. Oxygen delivery to the patient should be explained, including what equipment is to be used, such as a mask or nasal cannula, and the importance of keeping the apparatus in place. The equipment needed should be assembled, including the oxygen flow meter, humidifying bottle if ordered, nasal cannula, or appropriate face mask. The mask or cannula should be connected securely to the oxygen flow meter. Before applying a nasal cannula, the oxygen flow meter should be turned to the setting in liters per minute as required. Check to make sure that the oxygen is flowing freely through the tubing. There should be no kinks in the tubing. The connections should be all right. The nurse should apply a nasal cannula by placing the nasal prongs gently into the patient's nostrils, draping the tubing over the patient's ears, and sliding the feed connector up under the chin to hold the tubing securely in place. An oxygen face mask is applied by placing the molded plastic mask onto the patient's face over the nose and mouth. The nurse should pull the elastic strap over the patient's head to the back of the head and adjust the strap on both sides of the mask to secure the mask in a position that seals it against the face. The mask should fit snugly against the face, but must not press so tightly as to leave impressions on the skin. If the mask has a reservoir bag and its purpose is to serve as an oxygen reservoir, the nurse should check the oxygen is filling the bag before applying the mask. Determining the effectiveness of oxygen therapy involves several measures, including checking vital signs and peripheral percutaneous oxygen saturation, pulse oximetry. The nurse also needs to assess breathing pattern as well as the color of skin. Oxygen is flammable. No smoking signs should be posed when the patient is receiving oxygen. Electrical equipment must have special grounding adapters on plugs to avoid sparks. The patient and family should be warned of the dangers, such as exercising care when using oxygens near stoves, portable heating units, and ungrounded electrical equipment. Oxygen cylinders must be placed in a cart or base to avoid dropping or bumping the tank. Oxygen tanks or compressors should be turned off when not in use, and oxygen valves should be checked routinely to be sure that they are secure. Oxygen levels in reserve tanks should be monitored to ensure continuous therapy. That's all for today. Thank you. Here are the references.